Hello and welcome to this video on caesarean section, or an ancient surgery to facilitate childbirth when conventional vaginal delivery is not possible, that is still used today. Caesarean section, also known as a C-section or caesarean delivery, is a surgical procedure now, and it's one by which one, or in some cases multiple babies, can be delivered. It always involves an incision into the mother's abdomen, and this is because you can't deliver a baby via the vagina. This would be because, for example, the mother's life is at risk due to issues around the pelvis, size of the baby, issues to with obstructions, in some cases because of twins, high blood pressure, and there are a number of other issues that could make a caesarean necessary. The other reasons that are there is, well, to be quite blunt about it, the desire for a more convenient delivery. A caesarean, by comparison to more conventional vaginal delivery, is somewhat faster. It's somewhat similar recovery times, if not the same, and arguably, at least due to anesthesia, far less painful. It is noteworthy that caesarean delivery generally always follows another caesarean delivery, so if you have had one, there is a much higher chance that you will have a second, third, and so on. The history of caesarean sections is where things get a bit interesting. Historically, at least, they were performed upon a live woman and nearly always ended in death. This is because they didn't have the necessary knowledge, technology, and to a certain extent ability to preserve both mother and child's life. It was therefore considered an extreme measure in nearly all cases, and pretty much limited to only when the mother was already dead, or close enough to that there was no real way to prevent the mother from dying anyway. There is a speculation that Julius Caesar was born via caesarean section, but this is known to be false. There is an explanation as to how he came to be called Caesar, but this theory is a theoretical answer, and therefore there's no definitive proof one way or the other. It is thought that the name Caesar may be derived from the verb cedere, or to cut, and since children who were delivered via caesarean were also known as Cisones, it is possible that Caesar is a derivative of this. It's a sort of abbreviation of ab utero Caesar, or cut from the womb. This is at least somewhat further supported by Pliny the Elder referring to a Julius Caesar as being ab utero Caesar, so it does at least have better grounding than the justifications that Julius Caesar, the Roman leader, was actually a caesarean delivered child. That, however, isn't even the earliest explanations. It's simply a historical footnote that's made life a little more confusing for most people. The earliest records we do have go back to ancient China, somewhere between 1000 and 200 BC, so admittedly it's an 800-year window of time. It is described as Lu Shong, a 6th-generation descendant of the Mi household, or Mi Empire, that ruled part of China, was born this way, by cutting open the body as it is described. In contemporaneous records, or those of today, caesarean deliveries have increased consistently year on year. About 10 years ago, only 5% of deliveries were performed this way. Today, it's more than 30%. This has led to increasing costs across the board. There are long-term maternal issues, there are neonatal issues, and there are certain childhood complications, all associated with caesarean delivery. And of course, when you have complications and issues from it, there are attempts to address the root cause, but these have effectively failed, with no notable decrease or change in preference for it. The preference, as stated, is generally due to the much shorter-lived postpartum benefits, the request for absence of medication, and at least somewhat other issues to do with personal preference effectively. This has all led to a increase in the delivery rate, but also maternal mortality and morbidity as a result of caesarean delivery. The process itself is, well, at least relatively straightforward, and that is it begins with antibiotic prophylaxis, and this is basically sterilizing the skin that you're going to be making an incision in. Then the incision is made, and it's extended out with blunt pressure along the body. The infant is then delivered via the incision, and then the placenta is removed. The uterus is then either repaired or fixed via uterine exteriorization or in situ. This means either the uterus is taken out and stitched, or it's done in where it is. The approach is then debated as to whether or not it should be a single layer uterine closure, which is one single large stitch across where it needs to be, and this is generally done when there's no future pregnancies planned, or if future pregnancies are either planned or expected, and this is the other more debated option, multiple layers of sutures are used, starting with surgical sutures internally, and then more standard sutures external to this. There's also other issues around the post-operative treatment, and these practices include things like cervical dilation, subcutaneous drains, and supplemental oxygen therapy. The supplemental oxygen therapy is intended to prevent infection. Subcutaneous drains are to remove excess fluid from the incision and other issues associated with the surgery, and cervical dilation is, at least in part, intended to somewhat stimulate the normal processes of delivery, primarily relating to the baby's head pushing against the cervix, causing pressure and therefore the release of oxytocin, which does have carry-on effects to the rest of the pregnancy, or at least the rest of the child's early development, as it initiates things like lactation. Complications beyond surgical include the effects of things like anesthesia on the body. It is very common for females who undergo caesarean sections to have no bowel movement for several days, or at least up to several days. This means that you will get rather obvious effects from not having pooped in some time, cramps, nausea, and other issues. There are also reports of significant numbers of long-term issues about pain. This does range, however, between 13 and 78%, so it's not exactly clear if this is a specific issue to caesarean sections or if this is a surgeon-derived issue. One of the most convenient solutions to the matter of intestinal distress caused by being constipated is, funnily enough, chewing gum. And this is largely because chewing gum has often used things like aspartame or other artificial sweeteners, which also act as a laxative, and therefore effectively fixes the problem with almost no cost to speak of by comparison to what, say, American hospitals might charge you, where, along with the caesarean, you might need to sell a kidney. As mentioned, caesarean sections are not without their problems, largely by contrast to more conventional vaginal delivery, but nonetheless. These issues are all largely based or derived from issues to do with the fact that you are being rather invasive with this surgery, and that causes a significant increase in things like mortality and morbidity. Mortality being death, morbidity being reductions in quality of life, or other long-term complications. For example, there are issues around uterine rupture, abnormal placentation, ectopic pregnancies, stillbirth, preterm birth, and further problems again. The increased number of caesarean sections someone undergoes also increases the risk of this. As it's described in one publication, it's a dose-response manner, and that is a concern. The final major consideration with caesarean sections relates to, well, skin-to-skin contact after birth. Given conventional vaginal delivery, you would have something like the baby is born, the umbilical cord is cut, and then the mother is given the child. During caesarean delivery, that's not really an option, and that's simply because the mother still needs to be closed up, various other issues around fixing whatever damage has occurred, and waiting for analgesia and anesthesia to wear off. Once that happens, then the mother can be given the child, as there's not much point in giving it to her when she's asleep. The argument is the effect or appropriateness of giving the child to the mother, and ideally doing the surgery without the need to put the mother to sleep. This is largely because breastfeeding immediately after birth apparently increases the benefits, let's say, whereas delaying it does create problems around lactation and the ability of the child to breastfeed. This is one of the major reasons why cesarean sections generally have a much higher rate of supplementation after breastfeeding. Caesareans are also dissected into 4 categories, these being difficult to access the lower uterine segment, the complicated fetal extraction, laceration or organ damage, and abnormal placentation. In short, the first is relatively self-explanatory. That is, it's hard to get into the uterus where the baby is located. The complicated fetal extraction can be if the baby is positioned abnormally or in an awkward way, or they have an incredibly large head. That means you may not be able to get them out with the incision as originally made. Laceration or organ damage is, again, relatively self-apparent, with damage to either the uterus itself, surrounding tissues, or similar when you are trying to make your initial incision or during later work during the surgery. An abnormal placentation is when the placenta, the area that supports the baby's development in the uterus, becomes abnormal due to the surgery itself, or due to other complications unrelated to caesarean section. The caesarean section is generally performed always in urgent or emergency settings, but as said, it can be used as part of planned pregnancy. When being conducted as part of a urgent surgery, it's often a result of things like eclampsia or severe preeclampsia, uterine rupture, hemorrhage, or similar, or that the umbilical cord is prolapsed. These are all things that make it essential to either have the baby out immediately to ensure its survival, or to ensure the survival of the mother. The general gist of most research into this is that children delivered by caesarean section do have more long-term issues related to respiratory tract infections, obesity, and asthma than children delivered vaginally. However, the research on this is not clear as to whether or not it's a result of caesarean section delivery, or if there are other variables that confound this. To be quite blunt about it, it's more likely that individuals who deliver via caesarean section are either likely to be in a position where they're not exactly the healthiest of people, or they are well enough off that they don't really have to worry about anything, and therefore luxuries of life lead to things like obesity, or that the children aren't exposed to many of the pathogens that would prevent things like asthma from developing. Both historically and today, caesarean sections are much more suitable as an emergency procedure, and not as a first choice for convenience. The problem you have is that if it's as an emergency or a convenience, you have to almost always follow with subsequent caesarean sections to prevent other complications, which, to be quite clear about it, the more invasive and regular surgery is, the more likely you are to have issues, whether that is infection, complications, or any other number of problems that could come up from it. This is why, at least historically, it was a last option, but today, for some people, it's seen as a first and most obvious option. Thank you for watching this video. If you found it interesting, consider liking, sharing, and subscribing. Please post any comments, questions, or suggestions you have below.